Hello, and welcome to another episode of Pep Talks with Jeanne. I'm your host, Jeanne Pepper. I started doing Pep Talks as a way to inspire you to do intentional acts of kindness and to further the goals of Blaze It Forward. Over the past 6 years, Pep Talks evolved, and I now use it for interviewing key people in our community who volunteer at the next level. Some start foundations to further their philanthropic goals, some work at the most needed and influential nonprofits, or dedicate their lives to causes in their local or even global communities to make this world a better place. And today I'm happy to have Phil Yaeger with me from Radiant Healthcare here in Orange County. He's going to talk to us about his work there. Welcome to Pep Talks with Jeanne.
Hi, Jeanne. Thank you so much for having me.
It is a pleasure. I love Radiant Healthcare and what you do. Can you tell our listeners a little bit about Radiant?
Sure. Radiant Health Centers was founded in 1983 as AIDS Services Foundation Orange County in response to the HIV/AIDS epidemic. Yeah. We rebranded in 2017 to Radiant Health Centers as we expanded our mission and vision.
Okay.
And that expansion included expanding services to include medical care. And I can speak a little bit more about that and why that was important to AIDS Services Foundation Orange County to make that transition.
Yeah. Okay. Tell me.
Yeah. So we were founded, as I said, in 1985 as AIDS Services Foundation Orange County. In those early days, there really was not good, effective treatment.
Yeah.
And we basically helped people die with dignity.
It was like a hospice.
Yeah.
Okay.
Yeah. And then around 1995 is when the protease inhibitors, the new class of medications, combination therapy, became available. And we were able to shift our message and focus from helping people die with dignity to helping people live with hope.
Oh, that's amazing.
Yeah. And suddenly we also were considering, what does this mean for us as an organization? There's this great new treatment. It means we'll be, HIV and AIDS will no longer be an issue. We should probably start thinking about how we effectively close our doors.
Oh, wow.
Right. And here we are 30 years later, still very badly needed in the community. But over those 10 years when that new medication, new treatment came out, we really focused on building out the support services needed to keep people engaged in care and on treatment. So we really developed mental health services as well as nutrition, transportation to get folks to and from medical appointments, housing assistance to make sure that folks who were homeless were provided with housing support. We knew that was the only way to treat HIV in an individual that was homeless. And we really did, again, a great job of building out those support services. So around 2005, we realized that we do a great job of taking care of people once they're infected with HIV, but let's put some resources and energy towards preventing new infections. And so that's when we secured our first prevention grant with the CDC.
Oh, wow.
And that's when we began providing HIV testing services. So that was our first bit of foray into the medical arena. We were able to expand those testing services to our main facility in Irvine. And what you weren't hearing in the news was information around HIV and AIDS. There was a real period after from about 2005 to 2015 where, we'd be out in the community and people would say, well, isn't there medication for that? Hasn't AIDS been taken care of? It's no longer an issue. And when we would share with people that we were still experiencing 5 to 6 new infections in Orange County every week, right? The response was, I had no idea. We just don't hear about it. But the message is this is still very much a public health concern.
Yeah.
So one of the things, though, that was happening in the background was some incredible research. And so that's where the first research was happening around what we know today as PrEP. And so what they were able to do, it was the Prevention with Positives research project that took individuals who are living with HIV And we knew that with therapy, we were able to get the amount of virus in their body to an undetectable level.
Wow, that's amazing.
Yeah. And so the research really looked at discordant couples where one was living with HIV or positive and the other was negative. And what they found is that with individuals with a suppressed viral load or an undetectable viral load, they were not seeing transmission of HIV sexually to their partners.
At all.
At all.
Wow.
They actually ended the study early because the results were so overwhelming. The next piece of research that they launched into was to say, well, what happens if we take this HIV negative person and we give them that same HIV medication? Mm-hmm. And what they found very quickly as well is that HIV medication protected the individual up to 97% from acquiring HIV. So not a true vaccine because it would need to be taken daily, but what I refer to as almost a functional vaccine.
So interesting. So people that have it, if they stop taking that PrEP, they would become infected again? Or?
Very potentially, if somebody's negative and they stop taking PrEP and they get exposed, they could be infected. Mm-hmm. For somebody who's virally suppressed to stop taking the medication, potentially the virus will rise in their system, the level, and they will become infectious again. Yeah. But these were two new incredible tools, strategies for our prevention toolbox. And this is when 2016 is when you really began to see communities talk about ending the HIV epidemic.
That was a chance, right?
Yes. And so in 2016, Governor Cuomo, New York, was the first state to release their statewide plan to end the HIV epidemic.
Wow.
And that became a conversation nationally with AIDS service organizations, those of us who are providing support to communities, to say this is possible. But we all have to take responsibility and drive this forward in our communities.
Yes.
The federal government was not going to do that. They provide a level of support to care for people. They provide support for prevention. But really, this type of an effort took grassroots efforts. So our board of directors agreed and said, yes, we really want to see the organization be the leaders in Orange County in ending the HIV epidemic. And that was in 2016. And so what we were still seeing, however, is new infections in Orange County did drop, but only to 4 to 5 new infections a week, from 5 to 6. So still over 250 people a year diagnosed with HIV in Orange County. Nationally, that number was stuck around 40,000 people infected annually with HIV. And when they looked at who was becoming infected, it was primarily in communities of color.
Oh.
So, those of us in public health who sometimes think we have all the answers went, well, obviously they're having more unprotected sex. Obviously, we need to do more education and outreach. We need to really inform and educate this community. Mm-hmm. And within a year, the research very quickly showed that, no, these communities, these young men were not having more unprotected sex. They were very much well aware of how HIV was spread. What was missing is access to appropriate health care. So if they weren't going in for regular routine health care, they weren't getting screened for HIV to find out that they're negative, and maybe they should be prescribed PrEP to protect them from getting infected, or that they are HIV positive and not getting medication to get virally suppressed. They're continuing to spread the virus in the community. So we knew, and I went back to my board of directors and I said, great, you've approved us to join the fight to end the HIV epidemic in Orange County. Well, guess what? In order for us to effectively do that, we will need to address the healthcare inequities that exist for the LGBTQ plus community. A big shift, a transformational shift for the organization into an area of work that we did not have experience. But we were able to look at other AIDS service organizations across the country who had gone through a similar transformation and to learn from them. And so that's what we did in 2017. That's when we then rebranded from AIDS Services Foundation to Radiant Health Centers, because we knew that if we were to provide health care to young gay men who are not living with HIV, to lesbian women, they were probably not going to look at the AIDS service provider as the place to provide them with health care.
Yeah.
So our rebrand to Radiant Health Centers, expanded vision and mission. And in 2019, we began providing our first set of medical care and services to the community.
Okay, so the community. So people that are not part of the LGBTQ community can get health service there.
Absolutely.
Okay.
We turn nobody away. And what's interesting is with that question is we have found that there are sometimes young women who identify as heterosexual and feel much more comfortable coming into our LGBTQ plus focused clinic, knowing that most likely the provider will identify as part of the LGBTQ plus community, and they will be treated with absolute respect, absolutely no judgment, and just a very safe place to come seek health care.
So are they coming to seek health care because they may be HIV infected, or they want to prevent HIV infection?
We have both. So as we started those medical services and expanded those, we do have HIV care, medical care. Yeah. So we have a couple of providers who are experienced and able to provide that level of care.
Yeah.
And then a big part of the services that we provide in the clinic right now are preventative services. So access to PrEP medication, family planning services, STI screening services. And believe it or not, primary medical care was one of the last medical services that we added to what we serve.
Wow. And is that offered at like a for low income, or is that anybody that can get that?
It's services are provided to everybody. So if individuals have Medi-Cal as an insurance provider, we accept Medi-Cal, we accept Medicare. We've just added quite a few private insurance contracts to the list. So we have Blue Cross Blue Shield, Aetna, a number of private insurance. If somebody does show up for services and cannot pay, we will not turn them away for care.
I know where to go now.
So absolutely.
Perfect. That is really interesting. What about transgender? Is that something that you're helping people with?
That is such a great question. I mentioned colleagues across the country, right? And so one of my colleagues up in Portland, Oregon, who was with the Cascade AIDS Project, shared that, as they went through the transformation to LGBTQ plus care, they expected about 70% of that patient population to be seeking HIV care.
Oh, wow.
And what they found is that actually 70% of their patient population were seeking transgender care.
And they're getting it.
And they're getting it there. And we have experienced similar.
Okay.
So as we expanded and began providing medical care, we expected to see a majority of our patient population living with HIV seeking HIV care. Although that is a big part of our patient population, what we see more than anything is individuals seeking transgender care.
That is the most now.
That is the most.
Wow.
And what this has illustrated to me is that we have a hidden, unidentified need in our communities.
Yeah.
And I don't think we realize the number of individuals who are so desperate for appropriate transgender care and being able to seek it out and find it in a safe environment where they will be treated with respect. I think the need is much greater than any of us have realized.
Yeah, and expertise, because if you are transgender, you may not even know where to go. So why wouldn't you go to Radiant?
Yes.
Wow, that's really fascinating. So tell us a little bit about your history with Radiant. Like, when did you start there? What inspired you?
Yeah.
Tell us about it.
Yeah, so I joined Radiant Health Centers in 1993, so 30 years ago, as a volunteer.
As a volunteer?
As a volunteer.
Wow.
Yeah. And what had drawn me there is a friend of our family's, somebody who grew up around the corner from us, I was living in Mammoth at the time and was home visiting, and when I walked in the house, was told, "Well, JB passed away today," and I was shocked. I was like, I'm thinking he's a young 30-year-old man. I'm like, what? How did he pass? And they said, well, he had a lung infection. And I thought, a lung infection? 30-year-olds don't die of lung infections. I said, did he have AIDS? And the response was, well, we don't know, which told me yes. And it just killed me to think that the family had to deal with that in complete isolation without the support of friends and family because of the shame and stigma associated with AIDS at the time.
Yes.
And father had taken early retirement to be at home caregiver, and I just thought I can't fix what was, but what can I do to make a difference in this community? So I as silly as dialing 411 and said, I need you to connect me to an AIDS organization. And of course they connected me to the healthcare agency, and they're trying to get me to come in for a test. I'm like, I don't need a test. I want to volunteer. I need to support this work somehow. So they connected me to AIDS Services Foundation Orange County. And I started my volunteer work there doing basic office work, 4 hours a week.
Wow.
And one of my tasks was to take the file cabinet, which had all of the client files in there, and file the loose paperwork into those appropriate files.
Yeah.
And as I'm doing that, I'm seeing names of people I know.
Oh, wow.
I'm seeing like, oof, I dated that guy last year. And so suddenly, this was real. This was not just my community. These were people I knew. These were people that were part of my life. And I just was like...
really hit home.
Really, really hit home. And so really meaningful for me. About 4 months into my volunteer work, we had received a grant from the Elizabeth Taylor Foundation. And half the money was to go to the food pantry for food product. The other half was to hire a part-time food pantry coordinator. So they said, hey, Phil, we got this funding, and we've got this part-time food pantry coordinator job. And I was pleased, and honored. But I said, I don't know how I can live off of a part-time job at $9 an hour. I said, that's kind of tough. But my transportation job had some odd hours. And I realized that I could do both.
Oh, wow.
But I knew I could only do both for about 6 months max, and I'd burn out.
Yeah.
So I accepted the position gratefully, and within 3 weeks, I was like, oh, it's clear where I need to be. I need to be here at AIDS Services Foundation doing this work with the community. We don't have to review the mission of the organization because everybody knows every day why we're here. It's not a dog-eat-dog environment. We are all here collaborating and supporting and helping each other to take care of our community. It was a much, much different work experience.
Yeah.
So by December, after 6 months, they had another part-time role open up for a PR coordinator.
Wow.
So they were able to give me a full-time role and give me a little bit of a pay bump. And so that's how I first got involved. And honestly, I think part of why they hired me was my transportation background. Mm-hmm. So one of the first things I did after, working in the food pantry and expanding that was to start a transportation program.
Oh, yeah.
And then after that, moved to housing, developed housing services and a lot of the housing programs we currently have in place.
Yeah.
And then I was involved with the prevention work, led that work for a while, and then moved to outreach and engagement with Latino business community, the faith community. And then in 2008, the CEO role came open. And so I applied for the role then, and again was fortunate to be hired into that role.
Wow.
and I'll remind you, it was May of 2008, 2 months before the Great Recession of 2008. So yeah, 2 months on the job, we lost $1 million in funding from the state. I had to eliminate 11 positions, close one of our facilities. So it was a tough start, but I am so grateful for having had the opportunity to get up every day, to know that I'm going to work and I'm going to help my community, and I'm going to improve the lives of folks that I and we as an organization engage with. And I couldn't be more grateful to have that opportunity every day.
That's really something. So it's kind of proof that when you follow your passion in life, that you end up where you need to be.
Mm-hmm. Absolutely.
I love hearing that, because not only was it your passion, but it was something that helped the world, helped a community that needed help. So that makes me feel good. I love hearing this. Okay. So do you have opportunities for people to volunteer at Radiant Health Centers?
Yes.
And what kinds of things do you offer?
Oh, everything from food pantry support, food delivery, general office work, events.
Oh,
and so
wow.
on.
Oh, that's right. Like if people wanted to work to help you at your benefit.
Yes.
Okay.
Yeah.
And we find out about that through your website
Through
as
the
well?
website, yes.
Or
absolutely.
we can call you and take you out to lunch and find out more?
Absolutely.
Okay, super.
Absolutely.
And are there opportunities for high school students?
Yes, absolutely.
Wow.
In the food pantry, it's fun. It's like working in a little store. So.
And where are you located?
Irvine, Sky Park Circle, right near the airport.
And is that the actual health center, or is that your administrative offices?
That is the health center. Yes.
Okay, and you work in that center as
Yes,
well?
absolutely.
Okay, fabulous. Did you go to school to work in transportation? Like, what were your dreams like when you were young?
I really didn't know what I wanted to do when I was young.
Yeah, who does, right?
Right. I mean, I was, those first couple of years in college, like going, I don't know what I want to do. I'm too young. I want to go out and play. I want to, I kind of thought dentistry was where I would go, but that didn't happen.
Yeah.
But I wound up moving to the Mammoth Lakes area.
Yeah.
Beautiful resort community. I was going to take one winter off of college to go work at the ski area, and I was there for 10 years.
So you started college and then you ended up doing skiing for 10 years.
Skiing for 10 years, and that's where I really learned the transportation industry.
Oh, interesting.
Yeah, so I was able and fortunate enough to be part of the team that developed the transportation system that runs around the town of Mammoth Lakes today.
Yeah, that's
the
right.
Bus
It's
system.
really nice.
Yeah, so back in the 80s, I was involved in helping design and develop that. So that was great. And then when I returned to the Southern California area, and it was within a couple of years that I began my work at AIDS Services Foundation.
Okay, very cool. So after you moved back to Southern California, this was in 1980, 1990? 91. So at that point in time, if I remember correctly, AIDS had been an issue for about 10 years, maybe, probably about 10 years. Because I remember I was a teenager in the 80s, and I remember being afraid of getting it. I think it actually affected my dating life, affected my decisions in life, because we just didn't know what caused it. We didn't know how to cure it. We thought it was a death sentence. It was actually really scary. It was a scary time. It's frustrating to me that I would love to share personal stories with you from our own family about how AIDS has impacted our family and how it has. I wish that the stigma associated with being part of the LGBTQ community, I believe it obviously it affected Blaze dramatically, and it affected our family, because if not for that, members of our family could have come out sooner, not just Blaze. Blaze was not the only person in that community in our family, and it's a hard thing for me to I'm not okay with that, and I would love to see that change. So that I'm squarely with you on this. But tell me about the future of Radiant. I mean, we kind of touched on it, but what would you like to see change in the future, or grow, evolve? And where are we going?
So, great question. Thank you. I love talking about our future. The medical clinic, we've been operating since 2019. And one of the things that we are pursuing at this point is what is called Federally Qualified Health Center, or FQHC status,
Okay.
for our clinic. And what that means is that your typical community health center, community clinic, is going to get a Medi-Cal reimbursement of, I don't know, $25 per visit, right?
No, not a lot.
And take care of that person when they show up sick. They go home. They don't come back until they're sick again and they need new medication. What the federal government did a number of years ago, back in the 70s, was said, wait a minute, this really doesn't make sense that we're taking care of people only when they're sick. What if we provided preventative care, and rather than just amputating toes and feet, we address diabetes?
Oh, wow.
And what if, rather than pulling teeth, what if we provided preventative dental care?
Wow.
And so they developed the Federally Qualified Health Center model, where they said, community health center, we need you to look at your community population, what their issues are, and address all of those issues in a holistic way. If they're housing insecure, you need to address their housing. If they're food insecure, you need to provide nutritional assistance to folks. If they have mental illness that's untreated, you need to address that through behavioral health services. And yes, you need to provide preventive medical care that shows improved health outcomes. And you do all of that, and we will cover your full cost. So rather than that $25 per visit, if it costs you $250 to provide that full holistic approach, we will reimburse you at that rate.
Okay, why aren't you solving the homelessness problem then in California? If you could get paid to find housing, provide preventative care, and you get paid 100% for it by the federal government, what is going on here, Phil?
Yeah, the problem is resources. There just are not the resources, both in terms of addressing the mental health issues for a lot of the people that are currently homeless and living on the streets.
But you can provide that. They said they'll pay you.
Right. So we're moving towards becoming and getting that federally qualified health center status.
Are there any now?
Oh yeah, there's over 20 federally qualified health centers in Orange County.
Are there any in Los Angeles?
Yes, quite a few in Los Angeles as well. They're basically across the country.
Why are there so many homeless people that are mentally ill?
Yeah, it's a combination of care facilities that address the mental illness and also housing resources and housing stock.
But you're supposed to get housing for these people, right? I mean, you're going to get paid to do it. So why aren't these places doing it for them?
Well, they should be. I think the problem is way bigger, is so much larger than what the coalition of community health centers can address on their own. It's going to take an entire community approach, corporate, faith communities, and yes, the nonprofit sector, absolutely. But it really is going to take the entire community coming around to really address the homeless issue in our communities.
Okay, so you get this special status, and
Yes.
you get the federal government to pay for everything. So what do you need donors for?
Donors and private donors will help us create and launch new programs.
So things that are not covered.
Stuff that's not covered typically as part of the medical care for an individual. And also, if we don't have a program today that we would like to develop and grow, we don't currently have funding for it until you develop and grow it. And then we can, go back and secure the funding once we've incurred it. So private funding will be required to help us to continue to grow, to innovate, to create new programs and new services.
Wow.
And we have a current funding need because we don't have this federally qualified health center status
But
yet.
you'll get it. And are you worried you'll lose your donors?
No.
Okay,
no.
because there will still be programs that you want to offer, like maybe transgender services that may not be covered, or I don't know what they wouldn't cover.
There may be some aspect of care that we want to develop.
Possible.
Yeah, that we don't have the resources for. So yeah, and also we need to finish and complete building out the clinic
Okay, so this is a construction issue, and
As
that's
well.
not what they're willing to pay for. They want to provide services, but not the facilities to do so.
Correct.
Okay.
So we'll be responsible for developing the facility.
Yeah.
Our current clinic space is under remodel, and we have about $1 million in needs for that work. So there's opportunities for investment to support the work that we do.
Yeah.
At the foundational level and helping us get the clinic fully furnished, fully equipped, fully operational.
So you do not have funding right now secured to do that?
No. We have for some of it, but
Yeah.
we have needs that are outside of the current funding that we do have
Wow.
secured. So we have about $1 million in additional needs for the clinic that we will be working to raise through the community in the coming months.
So if someone wants to donate to Radiant Health Centers, how do they do that?
Well, there's one way for sure, and that's to reach out to myself.
Okay, Phil
Yes,
Yaeger at
Phil Yaeger.
Radiant Health Centers.
Right. RadiantHealthCenters.org is our website. My direct line is 949-809-5705, and I will gladly take calls from anybody who wants to learn more about what we do or wants to get engaged in the work we do.
And if they want to take you out to lunch?
I'd be more than happy to share with people exactly what we do and our impact in the community.
Okay, I'm going to call.
Awesome.
Awesome. So yeah, this is a really legit healthcare center that provides much needed services to not just the LGBTQ community, because as we've learned, they don't turn anybody away. Everybody that needs healthcare, it will be provided at no cost if there is not insurance or Medi-Cal or whatever it is available. So this is a truly altruistic organization. They will just give. And right now the facilities are being remodeled and there is a $1 million deficit, which is big.
Yes.
The needs are big.
Yes.
And this is a way that we can help people stay productive in our society, stay healthy, and to prevent transmission of disease,
Yes.
which is, really was the big impetus of the building and
Yes.
development of this organization.
Right.
So
Yeah.
it's fabulous. And who founded this organization? Are they still around? What are they up
There
to?
are some of our founding board members who are still around. It was a group of incredible individuals. Some lived in Laguna Beach.
Wow.
One of the founding members was a nurse at UCI, and so she had brought that perspective.
Wow.
And so the founding board members had just put a pool into their backyard, and so held a little backyard pool party with a little 6-minute aqua net show in the pool with the hopes of raising $25,000. They raised $33,000, which was the seed money that founded AIDS Services Foundation Orange County.
Isn't that amazing? I mean, that tells me that anybody that has a vision of helping others,
Yes.
whether it's to help cure disease, to help prevent disease, to help with the homelessness crisis in America, whatever the needs are, if you have a vision of how you can do it, you can raise the money and you can make it happen. I mean, these people made this happen, and now this disease is really just a bad dream, pretty much, and it will hopefully in my lifetime be eradicated.
Absolutely.
I hope that's my prayer, that no one should have to suffer from disease of any kind. This is a really it's not just a great story. It's actually extraordinary because the people that put this in motion have not only helped cure and prevent disease, but they've also helped. The ripple effects of this have been long-lasting and even multi-generational, because the original people that founded this organization, many of them may not even be alive anymore.
Right.
But still this organization continues, and it's continuing to evolve, and it will continue to serve the needs of the next generation and the next. So you see, when we do community service and when we give much needed funding to these really extraordinary projects, we are ensuring a better future for our children and a better world. So this is how we repair the world, people. It starts with these types of things. You have to have a vision of how you want to fix the world, and then you just need to make it happen. You need to ask for help. And people want to help. People want to fix things. I mean, obviously, there are a lot of people that want to destroy things, but we're not talking about those people today because they vibe at a much lower level than us. We are elevated here.
Yes.
So yeah, I mean, this is really where it's at. This is a great success story of helping people and helping a lot of people and changing lives. And this is a really beautiful thing. So what do you see the needs of the LGBTQ community being in the future, and how will you help with that? Is that going to be mostly a transgender issue, or are there other health concerns?
Yeah, I one of the programs that I'm really excited about is our youth services.
Oh yeah, that is really important. I'd love to talk about that with you.
Yes. So, youth services for youth who identify as transgender, gay, bi, non-binary, whatever. I see those services as so critically important. And I think that anything that we do with youth around LGBTQ plus issues, comfort, identity, is HIV prevention work as well.
Yeah, absolutely.
Because one of the things we really want to create and have for youth is an environment where they can talk about, ask questions, learn in areas and ways that they would not be able to otherwise, with neighborhood friends or friends at school.
Yeah.
And providing that safe space, I think is just incredibly impactful, and I think potentially more than I think what we realize in terms of suicide prevention, self-harm.
I was going to ask you about that. How, I mean, been my understanding that this is the highest at-risk group for teenagers for suicide, and it's preventable. I mean, we know that. So what kinds of mental health care services can we provide, and do these kids know they're available, and how do they access it, and what is Radiant doing to make sure that they are available and enough services?
Yeah. One of the things that we've been able to do is partner with the Santa Ana School District, so that we've been able to go on campus and provide counseling and support to students who may not have the means or ability to travel to our office in Irvine.
Okay.
We're also working with the Southwest Service Center as well, with youth programming there, and going in and being able to provide services and support to youth there.
Okay.
We've just developed a youth drop-in center. And
that's cool.
Yeah, and so it's a safe place for youth to come. We've got what we call a gender-affirming wardrobe. So for individuals who may not have opportunities to feel safe and to dress in a way that they feel comfortable, we've got a closet where they can take clothes if they want, but we have them there for them. And that, I think, is one of the services where we really have the greatest opportunity to really build out what we're doing.
Oh, I would agree with you on that.
The housing and homeless issue for young people is something I'm very, very concerned about, and it's something I think that is a top priority for us in addressing, creating safe spaces, because we know that of the homeless youth, close to 40% identify as LGBTQ plus, and that's why they are actually homeless.
And the school districts thought that it would be a good idea to out these kids.
Yeah.
Because they know more than parents and people in healthcare know, right?
Yeah, that was a tragedy for sure.
I know, but luckily I'm fairly certain that will not be an issue going forward.
Yeah. So our youth services is something very important, and I don't think we can do enough for youth in addressing their needs, and especially the mental health needs. And
that seems to be a crisis right now on every level.
Extreme crisis is how I would describe it. Yeah.
Absolutely.
So,
what about like Planned Parenthood services? Are those something that you offer, or do you collaborate with Planned Parenthood?
It's funny, we do collaborate and we provide very, very similar services. So we are also funded through what is called Title X funding here in the state of California. And that's what funds the Planned Parenthoods across the country.
Yeah.
We do receive Title X funding as well, because sexual health and family planning is one of the first services we began offering in the clinic. And I'm a little embarrassed, but I think I should share this, that when we were first approached about sexual health, birth control, family planning, and I said to my team, I said, well, they do realize that we serve primarily an LGBTQ plus community. And my staff looked at me and said, you do realize that they're capable of having sex with, my God, you're so right. It was,
because there's a B there too.
Heterosexual, right? Heterosexual
Right.
youth, they know. They got it down. They got their birth control down. They know what they're doing. I know so many members of the LGBTQ plus community who in high school or in college or whatever said, I'm going to go try it once.
Mm-hmm. And that could be the time.
And find themselves with a child.
Yeah.
I know so many gay men that have a grown child that they had it because nobody realized they needed the sexual health, family planning education as well.
It's just so fascinating. But yeah, well, that's great. They reproduced.
So that's one of the things that family planning, sexual health, incredibly important for our youth, protecting themselves. Very, very important.
Yeah, beautiful stuff. And then what about you? Do you have a family? Like, tell us about yourself.
I do not have I do have a family.
You do. You have a family of origin.
Yes, I do have I had wonderful, wonderful parents. They have both passed. I was so fortunate that they both lived to the age of 90.
Wow.
So I could not have asked for more there. I have 4 beautiful sisters and a number of nieces and nephews.
Big family too.
Yes, who are all grown. And my mother had the 5 of us in 6 years. So we are all very, very close in age.
Wow, that's quite impressive.
Yeah.
And she lived to be 90.
There's
a special place in heaven for her.
Absolutely.
Wow, that's quite impressive.
And you'll find my family at our events. They come down every year for AIDS Walk. They also come down every year for our annual gala.
How great is that?
They are very, very supportive of the work that I do in this community. So,
are there any other people in the LGBTQ community in your family?
I do have an older sister who identifies as lesbian.
Isn't that something?
Yeah, and what's interesting is she came out at, I'm going to say 45 years of age after 20 years of marriage and 2 children.
Yeah.
So, yeah.
Very interesting. Yeah. Anne Friedman, who was just here from Gay for Good, has a similar story.
Right.
Apparently it's a commonality. This is all like so fabulous. I really enjoyed I was at your gala this year and had the pleasure of introducing Javier Munoz of Hamilton, who was your guest of honor. And wow, that was like quite a magical evening. Wow. I mean, you just had like some of the most phenomenal philanthropists and unique people there ever. It was such a great event. And can you talk about like your budget and like how much money you were able to raise that night and how that all works?
Sure. So our annual operating budget is about $13 million at this point.
Yeah.
That will grow significantly once we secure that FQHC status.
Yeah.
And we really begin to expand and grow and add services. So that's what our annual budget looks like. I'm sorry, the other...
How much money were you able to raise this year at the gala?
Oh, so we raise about $2 million annually through private grants, foundations, individuals. I think at the gala this year, we raised close to $250,000.
That's phenomenal.
Yes. Yeah.
Wow.
We'd always like to raise more dollars. But grateful for every penny that really helps move our mission forward.
Yeah, it moves the needle
yes.
when people are generous. Yeah, that's really phenomenal. Anything that we missed or that you'd like to talk about?
I just want to thank you for this opportunity.
Well, of course. I was thrilled that you wanted to be on the hot seat.
To sit here.
Yeah.
And be able to not only share what we do at Radiant Health Centers, but to be with you and to know why you're doing this work. And it just means so much to me. So I just have incredible gratitude to you for that. So thank you.
Well, thank you for being here. I had a previous guest here who you know, and she said that I should like dig deep with you and like ask you since I have you here. And I know that our listeners would probably be just as fascinated as I am with like your spirituality. If you're willing to share, if you're not, I understand. It's kind of a personal thing, but
yes.
But I understand that like I have become a much more spiritual person of late. I never really considered myself a very religious person, more of a culturally religious person because I'm Jewish. So that it just kind of comes, it's kind of like you're born into a kind of royalty where there are no benefits, but I can't explain it. But you just kind of have to carry the mantle of being Jewish, whether you like it or not. It just kind of envelops you. But I'm just speaking for myself, though, personally. So, but I have had a spiritual awakening, and I feel like I have a much better understanding, and I'm much more at peace with. I'm never going to be okay with my son's death, but I'm much more at peace, believing that he still exists in this universe and as energy, and I don't believe that we really ever I don't really believe in death. I just think that it's just a transformation.
I agree, and very similar to you. I was not deep in religion as when I was younger. I was raised Catholic, and Catholic school for 12 years. So I mean, I had a very heavy religious indoctrination, but it never really stuck with me.
Yeah.
There were 2 or 3 things that stuck with me. God is everywhere. God is love. God is in all of us. Treat your neighbor as you want to be treated.
Maybe I'm Catholic. Wow.
But those were the things that really resonated.
Yeah.
And over the last couple of years, I've had a bit of a spiritual awakening and been on a spiritual journey myself as well. Which has just been phenomenal, absolutely phenomenal. And it really, one of the things that really resonates with me is, there's a song that speaks to being broken and being broken open. And we're broken open to let more light shine in.
Wow, that's really interesting. I'm like reading a book about that right now, but I think the title is like Broken.
Yeah.
And it's about this, it's interesting. The woman that wrote it founded the Omega Institute, which is is a spirituality center.
It's not Pendra. Is it Pendra Chopra?
Is she not an Indian
The Buddhist
person?
nun?
No.
Okay.
No. But that's we'll have to compare notes on what we're reading these days.
Yes. So, so I believe that when difficult times happen in our lives, and we've all had them, right? I've had them, and
you've had difficult times. This sounds like a fairy tale come true with Radiant Health Centers. I can't believe it.
Yeah, in those dark moments where you just feel so down and so empty, realizing that it creates that opportunity for light to come in, for growth, for deeper understanding. That has allowed me to take the challenges and the hits that come at me, that come at all of us, with a little more grace and a little more compassion, and being in business and with leadership responsibilities. You want to and feel sometimes you got to take care of everything, and everything must be correct, and everything must be right. And being able to let go of that and know that everything in the universe right now is as it should be.
Wow.
Provides that.
That's I mean, it seems so simple, but it's actually really profound what you just said, because it's almost like you have faith. Even though you're not a religious person, you have faith that things are the way they are because it's part of this reality was designed in this way.
Yeah.
And that we just need to let go and not worry so much about everything being perfect and everything going exactly according to plan. And believe me, I thought I had an exact plan for my life. In fact, my life was Rockwellian. It couldn't have been much better, and then like something happens and it's like, and believe it or not, like I don't believe that things happen for a reason, and I'll punch anyone that says that Blaze died for a reason. But at the same time, I believe that his life served a purpose, as short as it was. So the purpose was fulfilled.
Yes.
And whatever it was, even if that purpose was just to get me off my butt and doing something to make the world a better place, because he can't do it. So, it happened, and I was very blessed to have the time that I had with him. So I just I'm counting the eggs in the carton and not looking at the ones that are missing. So, and I had some eggs.
Yeah. Yeah.
Had some really good eggs. So, but I hear you that we just have to have faith that this universe was designed to teach us something, right? Is it learning for you? Like, what do you think your purpose is here? Like, is it to help people? Is it as simple as just growing radiant health centers? Or is it bigger than that?
At the end of the day, I think we're all here for a lesson in unconditional love.
Oh, I love that.
And when we learn that, we get there, I think things just open up for us in a much, much more brilliant way.
So true. I wish everybody felt that way. Don't you think this would be a much better world?
But it can be challenging. We've got this ego thing that just wants us to be right all the time, and wants us to...
I know, and it's not just that like we live in a modern world and like that's why we're all cutthroat and rat race, because like even like the Shoshone and the Navajo used to fight each other, and they had everything here. They had everything that they needed. They didn't overpopulate. They didn't. I mean, well, maybe they did. Maybe that's why they were fighting over natural resources. I don't know, but I mean, is it just tribal? Like, do we have to fight with people all the time? Like, can't we just be compassionate? Can't we try to be understanding? Or perhaps that's like why we're on this earth, because these are things we have to learn here so that we can ascend to a better place. Yeah. I like to think that there is a better place.
Yeah. And I agree with you. I think that we're here in this 3D world, as the vibration we show up in, and we might leave this physical world, but we're still around.
That's right.
I still feel people around me, loved ones around me who have passed. I feel their support. I feel their guidance. And I know a lot of people who have passed because of the work.
Oh, I'm sure
that I've done.
You've known them. Mm-hmm. Wow, you must have like an army of people supporting you.
That's what I heard. I was told one time during a session with a reader, and she immediately said, "Whoa, you've got a lot of spirit behind you." Damn. She said, "Do you know a lot of people that have passed?" And I said, "Well, as a matter of fact, yes."
Wow, I need to go work there. Yeah. I could use a lot of people on my side. That's awesome. Well, I believe that. I mean, and you have a great energy about you.
Thank you.
I have to say that.
Thank
like,
you,
there's certain people that like when at least for me, when I think about them, like I think of them as like a big smile. Like I think about them smiling and warm and like open arms and open, like open to listening, open to talking, even if they don't agree with you, they don't say you're stupid, or whatever, like some people are just like, you want to, like, I don't know about you, but like people like to tell me every detail of their lives in the first 10 minutes that I meet them. In fact, Uber has become like a place that I can learn about magnificent stories of people's lives in like a 10-minute drive. It's incredible. Yeah, I don't know what it is. Like people I think people want to be heard, and they're looking for someone to be curious, to see them, and to want to hear their story and to witness their life. So many people in this world where we're moving so fast and we're not taking the time to actually get to know the people that we interact with. We just, we give them their food and then we move on to the next person. But it's time, and you've shown that too with the work that you're doing. It's time for us to take a pause and really see people. And I'm going to keep saying this. We need to be curious.
Yeah. Yeah. I think you're absolutely right. And I think what you said, seeing people, when somebody realizes that this person sees me, that I think opens them up to share their stories with you.
Yes.
They know. They can feel.
I know it is. People can tell that, like, I am sincerely curious and interested in what they have to say about what their story is. And I don't know what it is. I was born this way. I have always been curious about people and like what makes them tick.
Yeah.
It's just part of my genetics. So,
Yep.
But it's been such a pleasure having you here today. I'm not going to keep you any longer because let's go have a big party and wrap today, shall we? Well, that's been another episode of Pep Talks with Jeanne. And once again, I would like to thank our guest, Phil Yaeger from Radiant Health Centers. Thank you for joining us.
Thank you so much, Jeanne. This has been a privilege. Reach out to us, www.radianthealthcenters.org. And there you can find information on getting involved to volunteer, donate, and support the work we do. Thank you so much.
Blaze It Forward is a campaign my family started to repair the world with kindness in honor of our son Blaze, who was murdered in 2018. You can learn more about Blaze and how you can make a difference on our website, blazebernstein.org, or on our Facebook group, #BlazeItForward. This month, #BlazeItForward is working on providing you with t-shirts if you're interested. We do these little fundraisers every once in a year or two, and all the proceeds this time will be donated to the ADL, who is working to prevent and correct hate speech in America for your benefit and mine. I would like to give a special thank you to all the volunteers that have helped with my philanthropic endeavors. Today, that is a thank you to my camera operator, Keith Anthony, and audio technician, Eli Moskowitz, who will also be wearing many hats doing the post-production too. Thank you all again for joining me. I'm Jeanne Pepper, and this has been another edition of Pep Talks with Jeanne.